State of Addiction coverage now, and tonight our year-long examination of the nation's opioid epidemic takes us to Philadelphia and a disturbing story highlighting the severity of the crisis. Transit Authority police had to revive a pregnant woman twice last night, 2 separate times. Officers were on patrol at Allegheny Station when they spotted the woman lying unconscious, overdosing. They administered the life-saving drug Narcan, but after being revived, she refused medical treatment. Less than an hour later, the officers found her overdosing again.
It is absolutely devastating. It's heartbreaking to see this happen. I'm a father. I can only think about my own children. Something like this happened to my own children, and it's a terrible issue.
The woman, who is believed to be about 7 months pregnant, was taken to the hospital. Locally, more and more law enforcement agencies are carrying Narcan to treat overdoses. Earlier this month, Seaside announced that police there will carry it.
Last year, Santa Cruz Police became the first law enforcement agency in the county to do so, and it's already proven effective. One officer saving the lives of 2 overdose victims in the last month. Action News reporter Phil Gomez has more on the program.
It's a lot of responsibility trying to revive this person, especially when you respond alone and you're waiting for the trained medics.
Santa Cruz police officer Bernadette Erlach began her naloxone training in December. She was one of 12 officers involved in the department's pilot program, and she got to put her training to use almost immediately.
It was fine, I thought. I don't know.
This unidentified man overdosed after smoking heroin. In this case, they supplied 2 nasal applications of the drug naloxone, also called Narcan. A paramedic then administered an additional dose via injection.
People are given a second chance when they hit rock bottom to come back and have an opportunity to have another life.
In a 1-month period, Officer Erlach saved not 1 but 2 people.
But I'm definitely proud to be part of the program and to show that it is working and we are saving lives, and it is a very safe program.
Since the Santa Cruz Police Department launched this program, 6 people have been saved from narcotic overdoses.
A lot of people who are addicted to opiates start with prescription medication, and once those prescriptions end, the addiction continues and they wind up on the street.
Police don't treat an overdose as a crime. Instead, they distribute a card like this because the overall goal is to save lives.
You can give it to a family member. We would give it to someone they know, or even leave it with them, an outreach card for them to get narcotic treatment, and hopefully they'll use it.
Dr. David Gilladucci is the Emergency Medical Services Director at the Santa Cruz County Health Services Agency. He oversees the pilot program.
The thing is with opioid overdoses, what these strong medicines do, drugs, what they do is they suppress respirations. And when somebody stops breathing, it really is just a matter of minutes. And that's why these critical interventions happening early on are so important.
It has now proven so successful, the Santa Cruz Police Department plans to expand it and train the entire force. The cost for the antidote, $6,000.
The Santa Cruz Police Department will be implementing this department-wide. Starting in October, we're going to train all our officers. We found this 1-year pilot program to be positive in providing a better service for our community.
In 2015, Santa Cruz County had 58 drug-related deaths, and with more people expected to die from heroin or prescription opiate overdoses, the Santa Cruz Police Department has been at the forefront of a national effort to reduce those deaths. In Santa Cruz, Phil Gomez, KSBW, Action News 8.